So this is kind of my bonus sinus move. I have to say that this particular thing that I'm going to show you has been something that I have used a gazillion times over my career. And it is so effective and amazing for people when they're stuffed up, especially when you have had somebody on their front and then they turn over and they've just been congested because the sinuses, the frontal sinus here, the ethmoids, the maxillary sinus, and of course, more internally, the sphenoid, they actually are the lowest points of reservoirs in your head. And so when you're face down, you really want to allow that flushing to take effect during having somebody flip over after being on their front for a while. And then, also if somebody is experiencing any kind of congestion in their head and sinuses. Some things that you can do is just, put pressure here. You can put pressure on the ethmoid sinus. You can put pressure on the frontal here. You can even do some kind of, sort of squeezing around the forehead here just to take some tension out of this area. And then for the nasal congestion that often happens with somebody is they'll have one side of their nose that's more congested than the other. And sometimes you can just tell. I mean, if the maxillary sinus is congested and you put your fingers in here like this and you just push up into the sinus underneath the teeth there, you can usually tell which side has a little bit more congestion or is more tender. I mean, he's pretty similar on both sides. I wouldn't be able to tell right now. Do you feel one's a little bit more tender than the other there, Kyle?
On the right side, it feels like you're able to push in more.
Right.
But not tender.
Yeah, exactly. That might be true, actually. Yeah, I can feel that too. Mm-hmm. Wow, good sensing.
Thanks.
So then here's what you do for the sinus decongestion is you say, okay, well, let's just say that I can push in easier here. So let's just hypothetically say that you were more congested in your left side. Mm-hmm. All right. So then what I would ask someone to do is I would push in their nostril from their right side. And now I'm closing down his nostril so he can only breathe in this side. And I'd say, can you breathe in that left nostril? And then when he's ready to exhale, I say, okay, exhale. And I just vibrate all in through here. So I do this little kind of vibrating thing, and now he's making me show it with my left hand, which isn't as good of a vibrator as my right. But now breathe in that left side. So we didn't actually have a before and after there, but we can do it on the right again. So often people will find that you've just kind of decongested that area. And then you can kind of flush it out, push it back down into the lymph here at the neck so that it moves down into the axillary area ultimately. So you can just kind of, do a little bit of lymphatic drainage afterwards. But let's try that on the right. So we'll get him to breathe in. Yeah. And then breathe out. And I mean, if there's enough space for 3 fingers, go ahead. But you basically are just kind of loosening stuff up in there. And go ahead and breathe in there now. Woo! So you can do this for yourself. You can basically, close off one nostril and then vibrate, that side, like close off the opposite side and vibrate. Yeah, and so you weren't really congested there, but how does that feel now? Do you feel like,
good. Yeah,
it feels good. Mm-hmm. You have to think, like Chinese medicine and traditional Chinese medicine and the acupuncturists who work at my clinic, like we have talked about acupuncture for something that helps sinus congestion. So if you're experiencing chronic sinus problems, especially seasonal allergy kind of related stuff, get acupuncture. It works miracles. I've seen people crying and stuffed up and red eyes and everything coming in and smiling, leaving a session, one session. I mean, a series of sessions at the beginning of the season of allergy season is really a good idea. So, and the reason why is because, the nasal, the breathing here, it relates to all the organs underneath that, the digestive system as well as the liver and the lungs, of course, right? And so, sometimes if somebody has a chronic side that gets blocked up, you can just put your hand on their chest and ask them to breathe into that side. And if they breathe into that side, you'll notice that their lung capacity on that side is often less, because they're not fully using. So if you can clear things up and give people sort of a sense of being able to, you can also sort of encourage them to really, when they are doing some kind of meditative deep breathing or whatever, to really also pay attention to their capacity to expand their lungs more on one side than the other.